I am going to put in the chat our link to the agenda in case anybody didn't see that already. Okay. All right, so Sue Ellen and I have not had a chance to connect before this meeting, and I am prepared to facilitate the meeting or hand it over to you, Sue Ellen. Um,
Well, thank you, Karen. Sorry, for not being able to connect. I don't have anything except to go down through your agenda. So, um, you know,
okay,
it doesn't matter to me. I don't have anything else to add.
okay. I might just go down through it just since I threw it together and we hadn't had a chance to chat about it. And one of the things I think I'm going to do is rearrange one of the first things I had on there was the falls prevention, but Beth Harrington is going to be late to the meeting if she's not already here. So I think I might drop that to the bottom because that was something that she had put on the agenda for today, if that's okay.
I think that's a good plan.
Okay. So I am going to go over our priorities that we've kind of established that we're going to be able to work on for 2025, as well as our hopes of what we want to work on for 2026. But one of the things is that we've talked about in the past is trying to get back to the committee of doing some work and some projects, and not just, I don't mean not just, but moving away from doing speakers and things like that for a meeting, and looking at trying to get some priorities tackled, kind of a thing. And the other aspect that's come up a couple of times that people have mentioned wanting to return to is having the opportunity to go around and hear from each organization about what's going on, things that we're working on, because people talked about there was a lot of connection that way, and we also would find out about trends and aspects that we needed to work on. So we're going to, in the beginning, um, I'm going to ask that people go around and introduce themselves to the group, as well as give maybe a short 1 to 2 minute, 3 minute if needed, what's going on in your area and your organization, in connection to the long-term care committee and that type of thing. Um, and I'm just gonna start, I'm gonna call out the first person who's on my screen, and then I'm gonna ask that person to call on the next person. And Sarah, you are the very first one on my
Ooh,
screen.
lots of pressure. So I'm Sarah I'm the an outreach counselor with the New York Statewide Senior Action Council. If you don't know, we're a nonprofit. We cover the whole state. We handle Medicare fraud for New York State. We also do patient rights issues, Medicare counseling. We continue to get a lot of patient rights calls on the helpline. We're getting a lot of fraud calls still on the helpline. I've had a lot of people with just presentations for advanced directives, a lot of questions and concerns about what's happening in the state of everything right now, all the things that are going on, a lot of uncertainty, what's happening with Medicare next year, a lot of questions about that, which we don't have a lot of concrete answers because we haven't really been given concrete, this is what it's going to look like next year for any changes that are coming down the pipe yet. So as soon as we get that, we have a weekly roundup that people can sign up for. It's free. It's an email that goes out every Friday where we round up senior issues, we round up health issues, things like that. So we're encouraging people, if you sign up for that, as soon as we have information, we will distribute it out via the weekly roundup. So it's a great way to stay up to date on information. But I'm definitely seeing a lot of people who are just concerned. Medicaid, Medicare, let's say, what are things going to look like? still running into a lot of people who are having issues with their medications, affording their medications, paying for different things. I've had a lot of people, how am I going to pay for long-term care? I have a family member, like, what do we do? How do we pay for it? I've had several people call lately that are very surprised that original Medicare doesn't pay for home care, like long-term at-home care. And they just assumed that original Medicare paid for that. And we're very shocked that it does not. So I've had to walk them through the options for how to get that covered at home. So we do that. We'll give them information about different ways to pay for that and how to help your family member in those circumstances. So we're seeing a lot of that on the helpline, where family members are just kind of struggling and having the unpleasant surprise of what is not covered under standard insurance. And how am I going to pay for that? If they don't qualify for Medicaid, what do I do? Will Medicaid even be here in the future? What's Medicaid going to look like in the future? So that's a lot of what I've been seeing in the last several months for sure. I don't know about everybody else, but
Thank you, Sarah. It's it seems to be a current trend that unfortunately, as we've talked about many years, is that until people are in the situation, it's not a topic that people are aware of. And so I think as a group, sometimes we um, we know we have to. It's just a constant education and constant providing that information is never probably going to go away, unfortunately.
yeah. One thing I have seen, which I think I would not be surprised by, is that there's been some talk that I've seen in general, not specifically with any one group or anything, that people don't necessarily know that Medicaid in their state is Medicaid because different states call Medicaid different things. So they might not actually be aware that they are on Medicaid or that Medicaid is something that they're getting with their family because they don't call it Medicaid in every state. So they might be like, oh, on Medicaid, I'm on Hawkeye, which is what they call it in one of the states, or something else, and they're just not even aware that that is Medicaid. So they're like, it's fine, Medicaid, losing Medicaid isn't going to affect me, and they don't realize that they even have Medicaid,
Hmm,
which I would not be surprised by at all if that were the case.
gosh, good points. Do you want to
Mm.
call the next person that you
Oh
see?
no, the next person next to me on my screen is Ben. That's who's my partner next to me on my screen this way.
Did you say my name?
Yep.
Okay, hi. My name is Ben Bassett. I'm from Finger Lakes Independent Center. We're an independent living center based out of Ithaca, New York. Independent living centers started out in California and Berkeley, I think in like the 60s or 70s. It's born out of the deinstitutionalization movement, and we have a board of directors that's majority people with disabilities, and I think most of the folks on our staff, well, most people in general have something going on with a disability of some sort. So I work for New York Connects. That started out. That's my particular program here at Flick, and I'm the only one who works for New York Connects at Flick. We all have our separate little areas that we work in, but it started out with just the Office of Aging doing that, and then the contract extended to the Independent Living Center, and that's where I came in. So I mean, obviously the Office of Aging is mostly elderly clientele, but it's not really age specific. So it's just anyone with a disability. Me personally, I've done stuff with assistive technology because we have that here at the center. Flick is kind of known for that for our loan closet. And, but I've helped people with housing. Housing is a big issue in Ithaca. If someone doesn't have a subsidy, these costs can be exorbitant and very difficult for someone of modest means to afford housing here. What else? Medicare, Medicaid. I was helping someone recently about Medicaid buy-in program, which that's that. I could go into detail about that, but it's all very It's all like the person who spoke before me was saying, Medicaid is a big question mark right now. So we don't know exactly what these cuts are going to hit, but we got to brace ourselves for whatever happens. And so right now is a challenging time because of the unsettling feeling. But we did just get our building painted, which is really nice. If anyone wants to see it, we got a cool mural. And it says, it's like picture of birds and hands doing sign language, and then it says empathy in big letters on our building. So I feel like we got to rise to the occasion to match that mural now. So anyway, that's about all I got.
Want to pick the next person?
Yeah, so let's do Jamie Ballas. Yeah.
Yeah, hi guys. I'm Jamie Ballas. I work with Cuga Health Partners, affiliated with Cuga Medical Center. We work with patients at discharge from the hospital, helping them identify social determinants of health, and how we can better help them in the community, ensuring, safe in the household. So whether that means food insecurities or, like Ben said, housing is a huge issue with our patients. We want to make sure they stay in the house, but as safe as possible and as long as possible. So I have worked with some of the folks in little Hollywood squares here, with some patients, helping them with getting to their appointments or if they need transportation. So we kind of utilize a lot of resources in the community, and help the certain primary care offices in the area. So we have a team about 9 or 10 care coordinators ranging from social workers to nurses to health educators, working with the primary care offices in the area, like on behalf of them. So we work with their patients in, assistance with, ranging from food insecurities and help with diabetes education. Like I just helped somebody with putting a sensor on yesterday, but it didn't work because his phone didn't participate or didn't sync in with, the app. So that was fun, but getting our, feet wet with certain things in the community. So it's never a dull moment. I'm sure like all of you come across in your daily, work life. So that's about, we want to prevent patients from going into the hospital. So we're trying to keep them safe as much as possible, and utilizing resources to help with that. So we have a pretty good team over with Cuga Health Partners, and we work really well together. And it's wonderful to see everybody's little square and face that, I possibly have talked to along the way. So I think that's kind of it in a nutshell.
Thanks, Jamie. You pick the next person.
I know Annie from previous work, so Annie, you're right below me, so I'll pass the baton to you.
Thank you, Jamie. My name is Annie Perry. I'm the service coordinator at McGraw House, and McGraw House is affordable housing for seniors 62 and over. We are 105 apartments right in downtown Ithaca, and working with people to age in place for as long as possible is one of our goals, but coming up against the need for home health care and how people afford that is definitely one of our challenges as well. For folks without Medicaid, affordability, and then for folks with Medicaid, just the consistency of consumer-directed care, I think, is really hard for people. So those are kind of the things that I'm working on here with respect to long-term care. And our wait list is always open. We do have a very long wait, but we like to say that's because McGraw House is just the best place for seniors in Ithaca. So I will pass it along to Sue Ellen, is the next person for me.
Okay, hi. I'm with Visiting Nurse Service, and we have a certified home care agency and also a licensed home care agency, and we also have a Medicaid health home. Our initiatives right now, we're newly affiliated with the hospital, and with that, we have access to their computer system called Epic, and we're able to have better communication. So one of the benefits of that is we have much better communication with the physicians' offices. And we're working with physicians' offices to better support some of their patients. And that relationship is working very well. The other initiative we have is with patients that are leaving the hospital that are going to nursing homes. So we have a liaison that is in the hospital every day for rounds. And as people are transitioning from the hospital to nursing homes, we're talking with them. And if they're agreeable, we'll follow them. We'll have one of our nurses follow them while they're in the nursing home to make sure that they get the services that they need to help stabilize them when they do go home. We've found that a lot of times patients are calling us after they're discharged, and they just did not have any services set up for them. So we're hoping that that can provide better support for them. And then the other thing, we did apply for a grant called Capable, and that's a grant for OT nursing as a handy person to help people in the community. But we have not heard back if anybody has gotten the grant yet. So we're anxiously awaiting for that. And I guess for me, the next person would be Karen Bullis.
Hello, I'm Karen Bullis. I'm the deputy at the Office for the Aging. I'll let Lisa talk about what we do, but I'm going to just mention our Senior Living Expo that we had this past Friday. I just wanted to share that it was very successful. We had about 150 people come through. It was at the Hotel Ithaca. Some of you were there. Thank you for all of your support and for attending. For the vendors who were there, I have sent out a survey, kind of getting your feel on how you thought it was run, the venue, etc. That feedback is very vital for our future planning. But thank you to everyone. We were excited to bring it back. We just celebrated our 50th anniversary, so it was tied in with the expo. So that was fun. There was cake, which people really liked. So that's about it. Thank you. I'm going to pick on Lisa then. You can get Office for the Aging all in once.
I can't find my mouse. I have too many screens open and my cursor was off in nowhere land here. Hi, I'm Lisa Monroe, the director at the Office for the Aging. Thank you, Karen. So we kind of, under our New York Connects program, we're required to kind of spearhead this long-term care committee. And fortunately, we have the great people from Human Services Coalition that are doing all the work really, to make sure that happens, which is great. Our office provides, information, resources, and programs for people that are over 60 mainly, but some of our programs are for under 60 as well, like our New York Connects program and our partners with Flick on that, and also our caregiver programs and a few other things that we do. But we've got a lot going on. Everything budget at the moment, which is enough. So I'll leave it at that. Let's see. I think Dina, have you gone yet? Okay, great. Dina.
Not yet. Thank you, Lisa.
Mhm.
Hi everyone. My name is Dina Lindhorst. I'm the executive director of Love Living at Home. If you are not familiar with us, we are a member-run organization, and we help folks also age in place. We offer volunteer services such as transportation, light home maintenance, gardening, friendly visits, and things like that. And then we also offer social events and programs for seniors. Our members are age 50 plus and residents of Tompkins County or surrounding. And We actually recently won the 2025 Not-for-Profit Award from the Chamber of Commerce. So we are excited and celebrating that. We do have sponsored spots available for members. Otherwise, there is a membership fee that's roughly $43 a month for an individual. So I should mention with this group too, we do not provide medical related services, just referral. So that probably makes us, great partners with those of you in the medical field. And Serena, have you already introduced yourself?
Haven't, Dina. It's so good to see
You
you. So great
too.
to hear about the award. Congratulations.
Thank you.
It's so great to see you guys. I'm Serena. For folks who don't know me, I've been on this committee since 2020, back when I was working as a contractor with Flick and with HSC with Bev Chin and Terry Reineman. What an era. Miss them. And yeah, now I work actually at Hugo Medical Center Foundation with Steph Bailey, who some of you might know from the community. Lots of philanthropy work going on over here. We're working hard to support folks, and like many of you said, kind of a hard time for funding important ventures around our community. So thank you all for the work you're doing every day too, and working with folks like Jamie and others that are across the whole health system, connecting patients with things that they could need and supporting those initiatives through philanthropy. So that's a big part of my role. I also have a note about an affiliation that happened, I guess, last year now with the Cancer Resource Center of the Finger Lakes that I'm sure many of you have worked with before. They're an affiliate now of Cayuga Health. So I've actually been helping coordinate this year's walkathon, which is very exciting. We have a date. It's coming in the first weekend of October, October 4th. So if you'd like to save the date, it's a Saturday. It's going to be a great event as always over on the Cass Park side of the inlet, doing a great walkathon and 5K run. And registration is actually going to open on Monday. So hopefully if you keep in touch with their website and their social media, you'll see how to register and you can send folks that direction. It's going to be a really great one. So that's a lot of my time these days. And I'll send it over to Bill. It's good to meet you, Bill.
Maybe I'll get there. Hi, I'm Bill Gilligan. I'm a board member of the Health Planning Council, and I'll let Nicole describe that. I'm also a volunteer at Lifelong for the Medicare Counseling Program and the Tax Preparation Program. And I'm here primarily as a member of the Health Planning Council for updates on the information about what's impacting the community, particularly we senior citizens in the community. So that's my interest in being here. And I will route it to Amy. Have you already spoken? You're up.
Trying to unmute there. Thank you. So I'm Amy Jackson. I'm one of the aging services specialists at the Office for the Aging. I'm sorry. Were you able to hear me? Because I think my headset was okay. I'm one of the aging services specialists at COFA, and I also am the caregiver resources coordinator, so all things caregivers. I don't really have any announcements or anything other than what Karen and Lisa have already mentioned. We do health insurance counseling through the whole year as well as during open enrollment too. So I will turn it over to Dawn.
Hi, I'm piggybacking on Amy Jackson's Zoom. I'm Dawn Sprague. I'm an aging services specialist with Office for the Aging. We do information assistance to our older community members. Also, the 3 aging services specialists are certified high cap counselors. So we do Medicare, Medicaid, insurance counseling. And I also have a program called Project Care, which is a friendly visiting program for anyone 60 and over in Tompkins County. So I match older adults with volunteers from the community or the local colleges, and they provide weekly visits. And Kristen Wells, have you gone yet? Is she there?
Hi, I have not gone yet.
Okay.
Thank you. So my name is Kristen Wells. I am the Executive Director of Gadabout Transportation Services, and we provide transportation, low cost and accessible to folks that are 55 and over, and folks that have disabilities that prevent them from utilizing the fixed route service, which is TCAT. So we have two services that we provide to the community. We have our regular Gadabout rides, which we provide to anyone 55 and over. And we also provide the contracted paratransit service for TCAT for folks that have disabilities that interfere with their use of public transportation. And I don't believe I have any updates. So I will pass it over to, I don't know if Nicole has gone yet from HSC.
No, thank you, Kristen. I'm eating my lunch, so I'm here, but my camera's off. Hi, everyone. Nicole Zulu. For those that don't know me, I am the Director of Health Planning at the Human Services Coalition. In my role here, I convene the Health Planning Council, as Bill had mentioned. We meet throughout the year, most months of the year, to work together as an advisory board, sometimes inviting also community members to join us, looking to either provide some information or provide opportunities for collaboration and coordination to improve health outcomes in Tompkins County. And we are the Rural Health Network for Tompkins County as well. I also supervise our health insurance navigators here that enroll individuals in our community in New York State of Health plans. So of course, we're talking about New York State of Health managed Medicaid, having a lot of uncertainty, as well as the ACA expansions that are set to expire at the end of this year, which at this point is a lot of uncertainty around that. And also our community health advocates, who also work a lot with people in issues around long-term care or Medicare as well, assisting people with any type of health insurance issues they're having, whether it's billing, denials, finding providers, and it's regardless of type of health insurance. And then I also supervise our project manager for our Community Health and Resource Network, which several individuals, organizations that are represented here are part of. We are connecting community members to care through a network and a platform, really focusing on bringing medical care and social care services together and working together to meet people where they're at and hopefully fill the needs, their unmet needs. Also, for those who aren't familiar, at Human Service Coalition, we of course have our 2-in-1 program that works closely with our Community Health and Resource Network, and many individuals here around transportation, housing needs. We have our continuum of care here, as well as our leadership development and consultant. We do a lot of things here, and it's really always hard to explain it briefly. But and then one of the things the Health Planning Council does, as was mentioned earlier, is we help support New York Connects by bringing together long-term care committees. So thank you all for being here. And I know Samantha said Mike wasn't working, and I know there's a phone number. I don't know if that person is able to speak or wants to, but I think that's all that's left.
Okay, if anybody ends up wanting to jump in that didn't get a chance, just let us know, kind of a thing. And I'm Karen Brown, and I formerly worked at the Gerontology Institute, and I have had the pleasure of being asked to still stay involved with the long-term care committee to try to help us keep the meetings going. And while I don't have a affiliation at this point with a certain organization, I do have a lot of family members who are accessing care in the area and have a lot of experience along those lines. Also have a lot of experience in health literacy, so have that lens on quite a bit as we're doing this work. And I want to apologize. It looks like I'm on my phone, but I'm trying to use it to look at the agenda at the same time as this because I'm on a laptop and I feel extremely lost not having multiple screens. So bear with me as I do that and try to look at the chat and those type of things all at the same time. I used to feel somewhat tech savvy I have hit a block where I now feel like I'm going down on the other end of it, so bear with me. I don't see Beth here yet, so I'm going to go ahead and talk about our somewhat of our charge and of our idea of what we'd like to accomplish in the remainder of 2025. One of the things that Nicole and Lisa and Karen and I, we met and talked that the discharge and transition planning resource um, is something that we'd like to take a look at, see if people are using it, see if it's helpful, and try to get an idea of now that we're, Carolyn Byers put together this really good document prior to COVID, and it was a start for people to be able to have access. I'm not sure how many people still know where it is. I started to look at it and could see that there were people on there that aren't in those positions anymore. So I did in our agenda, I did put in a Google link to the directory that we have currently, and it is a spreadsheet. Um, and we want to go through that and update it. But B, I think you may have seen in the agenda that went out as well, is that there's a survey that I put together that we want to put out to individuals, organizations, folks who are working with people, trying to get them connected during discharge, transition, whether they're going to long-term care, whether they're going home, and get an idea of what's needed. We want to know whether or not, is it just, we're in the day and age where we have New York Connects, we have the internet, we have different ways that people can find information and services. Do we need to also look at trainings for the different people in the organizations? Doing what type of, or for community members, what would be most helpful? So we did put together a survey, and I'll be looking at trying to get people to help me get the survey to the right people, and making sure that we take a look at it. One of the things that's come up as well is identifying that we need to get more diverse members on the committee to work in the discharge and transition, particularly looking at trying to get some of the long-term care um, folks back on and involved. And another thing that's come up, I'm trying to think of a way that it's going to sound as collaborative as I mean in it. We have a wonderful thing that's happening with Cayuga Medical and Centralis, and connecting with all of the organizations and things, a lot of affiliations going on, but we also want to make sure that other health providers in the area are being brought to the table, so that we make sure that the well-rounded communication is happening. So those are the other type of things that we're looking at. I wanted to open up, so that's our goal for 2025, is to update that directory and identify what could be most useful for the organizations in helping in discharge planning, and look at getting new members. I wanted to open up the room to have a conversation around that now, of thoughts, ideas around that.
Karen, this is Sue Ellen. I would say those are two really good goals, for 2025.
Yeah, I will also be looking at probably doing meeting by email, by Google Docs, and also getting additional meetings when needed. Um, and we definitely will need help with, I'll need help with getting people to also help around that area if people are interested in it. Um, And Sue Ellen, if you end up having a chance to look at the survey and you think there are other questions that should be asked or whatever, let me know.
Okay.
It's easy to add
Yeah.
those. Can I get a kind of a sense of people in this group now? Were you aware of the directory and how to access it? If you knew how you can use your little hand thing, put your hand up in the thing. If you knew how to access it and where it was. Okay.
I'm just gonna say I knew it existed, but I hadn't seen it or really knew where to find it. I think when the four of us met, I feel like there was at one point some password protected that I think lived on the Human
Yes.
Services, right, Coalition website of how you could access that list. But yeah, I think it definitely is worth updating and making a little bit more available for folks.
Karen, is the directory meant for providers or is it meant for, patients?
I think it was for providers and like community or
Okay.
based organizations. It
Okay.
was more of a what do I do if I need help with this kind of a thing.
Is there anything for patients? Or, just not necessarily patients, but just people in the community that could benefit from resources?
I don't know the answer to that.
Or is that just, what people could access through New York Connects?
I guess that was going to be my gut reaction, and
Mm-hmm.
other people might
That's what I
have
was
a
gonna
better
say.
answer.
I was actually gonna say that with the New York Connects resource directory or,
Mm-hmm.
our information, they both lead you back to us for the most part, or Ben.
Yeah.
A lot of times by county, you can find like a county directory of resources by individual county, because I cover 23 counties. So I do that for some of the outlier counties where I'm like, I need to know in a county that is one that I'm not in that often, I need to know resources. So if you Google just county resources like PDF, a lot of times you can find like a PDF of the resources that you can then send to somebody. I've done that quite often when I need to get kind of a catch-all of resources for somebody in a county that I don't
I
know
think
as well.
that's helpful. I mean, for our county though, it's kind of Googled something and come up with documents that were, everything lives on the internet and there might not be accurate.
Yeah,
So
or it could be
we
10
have to
years
be.
old.
Yeah, exactly. So, I mean, it's hard enough. We keep our resource guides, our
Uh-huh.
physical resource guides once a year, update them, and it's almost like they get out of print and they're already, there's already things that need to be changed in them. So
Yeah.
it is really hard. And I will say the New York Connects resource directory is not perfect either. I mean, the back end of that to, make sure it includes everything is it's mediocre at best. And I think that you get a lot of agencies from other counties that say they cover Tompkins, but they don't necessarily cover Tompkins, so they show up in the resource guide. So it's like you have to, sometimes talking to a person is probably your best bet, but it's a start.
I like this idea because I feel like in 2025 and moving forward, having a way to have a tighter knit resource coalition is going to be good. Because I
Yeah.
feel like if anything, we're going to need to depend on each other more moving forward than we have ever, and
Yeah.
be able to have the people that we can call to say, I have somebody for that. Let me call them and have, know who you can call and know who actually is in that area. Because I agree with you that there's a lot of times where I get people that, are like, oh, we don't actually serve that county, or, we can't do that or whatever. You run into those roadblocks all the time where you're trying to help somebody or nobody calls back, or, it's an automated phone tree and they can't get to a person sometimes depending on the agency. So those are all really difficult barriers for beneficiaries that I find they come back and say, I called, but never connected to an actual resource for them that helped them at the end of whatever that journey is. So I think having this will be really nice because it will be like a shortcut to like actual help, which would be good.
Another thing I want to add as I hear this conversation, I mentioned our Community Health and Resource Network, which several individuals as COFA are a member of the network. It has a wonderful resource directory just for the network that we create with each organization. And it's a really wonderful thing our project manager, Alex Moore, has created. And right now, this has been a pilot, like it's a partnership with Human Service Coalition, Cuba Health, and we had our first cohort, but we are opening it up to any organization to join in the next 2 months. So keep an eye out. We're going to be doing some outreach, and then we're going to just put like a call out, probably like on social media, on the listserv, that if you'd like to become a member of the network, we're going to have like kind of like an open call, and then we're going to kind of just have like a meeting to bring all network members together. But it's another great way to get people connected, and also have a really great understanding of what each organization does. So I'm just going to put that out here for those who are not involved in the network, and I'll put the link for it on our website in the chat if anyone wants to check it out. There's also a screener on our website that you can kind of go in, and it's asking about like social care needs. And if someone is not a network, they could still get access to a network by having them or someone they serve complete the screener. So just wanted to plug that. I felt like it was relevant to this conversation.
Great.
Karen, back to what Sue Ellen asked about patients doing it. Maybe some modification of this directory, once it's updated, should go to 211.
Yeah.
So that they would have, at least information that if a provider's not giving the right information, that they could ask questions at least.
Yeah, that's a good idea. Okay, so I'll be working on that and getting out some emails and some like kind of instructions of like, take a look at this, or here's a group time that's going to meet if you're interested in it. So we don't have time to tackle it all today, but I just wanted to get your input. I did put the directory out there and you can make comments on it if you need to. Also, if you have updates, please send it to me and I'll be working on that. There are some gaps of where I don't know who the people are anymore. So I'm also we're reaching out to Emily Mailer and working on trying to also get the other people around the table that need to for this group. So also if you have suggestions or you want to be a part of not only getting the directory updated, but looking at recruiting and assessing needs. We used to meet on a regular basis with a couple key people to talk about some issues that were going on around that and try to address things in real time. So that's another opportunity as well. I'm going to move on to the 2026 unless anybody has any last minute thoughts on that due to time wise. So speaking of things that are kind of out of date and on the web page, if you click on to looking for hoarding resources, you'll find a field guide that was put together back in, I think it was 2009 from a task force, and there's still a web page and all that stuff. So hoarding continues to come up as an issue, a safety issue. It can be an issue for people staying in the home. And we want to take a look at in 2026 next year, putting that as our goal is to review the field guide that I've linked. Also, you can take a look at the web page. And we want to take a look at maybe looking at can we reconvene the task force, looking at updating it. When we met to talk about this, we identified that this, extends beyond just long-term care. This also goes into a lot of different areas in health planning and for our community that other groups could be interested in looking at it. And we want to look at how can we bring training into the community, both for providers, but also for community members and caregivers, and looking at it from a preventative aspect, in addition to what do you do if you're in a crisis situation, but how can we also be looking at getting other organizations involved in that? So you have the information on that. I'll be providing more in the next meetings coming up. But if anybody has interest in the hoarding or has suggestions quickly to talk about, we can this time, or I can put on the agenda for next time. Let me know. Is there anything that pops up that we should know before we move off of it? Okay. All right. So I just wanted to give you kind of an idea that will be a project that we'll be focusing on in 2026. And if you could, I would really appreciate taking a look at that information before we um, meet the next time, but just as an idea of like what's out there, so that we know what needs to be updated, what may still be options, those type of things. All right, so the last thing that was on my agenda before we open it up for other things that might be there is I've been talking with Beth Harrington about falls prevention and the need for in the community getting that going again. We used to have a program that the Long-Term Care Committee supported. And when Beth was in the role of the Director of Emergency Response, she was able to provide the committee with fall data, so we could see, where there was a lot of need for it, as well as looking at was there any impact from the programs that we were doing, those type of things. So she's been gently encouraging me to again take a look at this from our committee. And she had sent to me the National Council for Older Adults, I think that's what NOCA stands for, is doing a Falls Prevention Awareness Week in September. And I included, there's a toolkit. I also included the links for reports on the impact, tips for talking about falls prevention, a day of action. So basically, I put all of the information that's there. We have the ability to do one of a couple of things. We could just, as a group, take a look at, do we want to do an awareness just for the day, for the week, to try to get along with that, to support it from the long-term care committee. But we also have the opportunity to take a look at, can we get a campaign up and going for a little bit longer? And so I have sent an email out to Ithaca College's occupational therapy director, because in the past Jessica Taves had helped us with that. And I was seeing if there's any interest. We've also extended an invite to the current director of emergency response, John, to see if he would like to join to help us with also having some of the data. But I think minimally, as a group for our long-term care committee, it would be nice to at least put out the social media plugs and the ideas of being aware of it and understanding. But there are several evidence-based programs that maybe we want to get behind. And I wanted to open it up to the group to talk about interest and thoughts about getting folks here in this group and other partners involved in a falls prevention awareness.
Well, this is Sue Ellen. This is a very valuable project. I know with our home care patients, falls is one of the major risks that our patients have, and they can end up with, total hip fracture, in the hospital with surgery. So, and I know about the education in the falls programs, which is, we try to incorporate it when we admit any patient. We run down through, there's a safety brochure, for people to look at, throw rugs, electrical cords, and we try to, evaluate the home whenever we do an admission. But it is such a risk for the elderly. It's a very valuable, program.
I'll just add to that, Sue Ellen, just so everybody knows, because I know there's new people, but we do from our office do free home falls assessments for them too, for other people that aren't, necessarily VNS clients. And also we have 2 CAPS certified, the certified aging in place specialists that also can help, with some tips and tricks, not only for falls, but just to have your home function and more livable, easier for people to age in place. But just so people know that we can help with that too.
And Lisa, that was one of the reasons we were excited about applying for that Capable grant,
Yeah.
because a lot of that grant is for money to do some home repairs,
Yes.
to make a home safer. We're still hoping we hear, but it is,
Yeah.
it's a real risk for, all of our residents.
It is that, yeah, that's a great point. And we're able to connect some people too with we have we have a contract with INHS, for their small home repair program. And they don't like me to call it that because people think I'm talking about tiny homes. So they call it minor home repair program. So it's not small homes, it's just minor home repairs. But there's never enough money. I mean, there's a huge
Yeah.
waiting list. So any other help in that area would be great.
And just to pay off of that, little shameless plug that on September 18th, INHS is holding a class about preparing your home for aging in place. And Andrea Davis, who is an aging services specialist in our office and is also one of the CAP certified staff, will be presenting at that class. So I can put the link in the chat if anyone's interested.
And that's perfect timing
Yeah.
with the awareness week. It's just a couple of days before it, but we could, maybe that could be tied into the National Awareness Week.
I don't even think we were aware of that at the time when we planned it, so that's great.
I'm wondering if that's a great idea, Sue Ellen, is maybe we could gather and maybe people could email me as well as put in the chat, but email me what you're doing around falls prevention stuff so that I could maybe showcase that in an announcement or something that if we look at, using some of that, their toolkit of promoting it, we could promote what's already happening.
I'll also say that Anne Riley from Riley Physical Therapy is a great resource as well. And she actually had performed, along with some support from Cayuga Med, the free fall screenings at, and just to kind of show how important it is, at our expo. And she said that it was the most attended of the screenings that she's ever had. She had about 50 people come through requesting these screenings. So it's definitely, people are definitely aware and concerned. So she'd be a good resource, I think.
Great.
The other thing, when we did it before, we actually had really neat little booklets that I think actually came from COPA. One was on just falls prevention in general, and the other one was a home safety checklist where you actually could go through and look room to room and see what might be there. If we could do something like that again, and we could have the hospital or nursing homes or whatever hand out those booklets on discharge,
Yeah.
We actually
we
still
still
have
have 'em.
very, but yeah, I was gonna say very many of, it was the Step Up to Stop Falls.
Yeah.
Yes.
We have
The
several of
Health
those
Foundation's
still.
grant.
Yeah.
Yep. From years ago.
Yeah, we put that booklet in our packet that we give all of our home care patients when we do the admission.
And we might be able to even, kind of with some permissions, duplicate it somehow. Because there's a lot of extra things in there that are great, but we could maybe tailor it to what's local because there's suggestions and whatnot in there. So maybe we could create our own, that we could all share.
That's a great idea.
And stick to the basics and not overwhelm them, but really
Yeah.
get that basic information out to them.
Yeah, that's the one thing about that booklet, the Step Up to Prevent Falls or whatever it's called, is that it's very health literate.
Yeah.
Mhm.
It's some, simple and it's health literate, and I think it's easy for patients to follow.
Mhm.
I was also wondering, and I don't see Liza here today, but maybe Bill, but I reach out. I was thinking about Lifelong and other places that are doing some exercise classes. But you've got Lifelong who is doing a lot of well, either the chair yoga or the strength training or whatever they're doing, but they've got a couple of classes that would really help along those lines. And I'm wondering if there's any way to get like a kind of a spotlight on some of those programs that are in the community, like, so to refer people to be able to go to. And I don't know if GIAC is doing things or I feel like a little out of the loop of knowing what's available, but was just thinking about if there's also something to, in addition to a brochure, do you know what I mean? But like either doing a
And I,
demo or getting
I
people to.
feel like hasn't Lifelong in the past do like a regular kind of falls prevention thing? I feel
I
like
feel
we've
like
tabled
they
at that before.
I feel like they did, and
Yeah.
maybe you could reach out to Lifelong and see what's going on.
Yeah, we always promoted, especially Tai Chi and chair yoga and all that as part of that whole campaign was, exercises to help prevent falls in
Yeah.
this physical sense.
Does
There's
New
quite a
York
few
State,
evidence-based programs that are happening, and I know that the YMCA does an evidence-based program. And I heard actually, this is weird. I didn't know this myself, but my mother-in-law told me. But Crunch Fitness actually does silver sneakers, and they bill Medicaid, so they hook people right up
oh,
to, yeah, which is interesting to me. Um, and it's a free membership too, so they don't have to pay. They just,
It's
as long as
Lisa,
they're
did
going.
you say it's called Silver Sneakers?
Yeah, it's an evidence-based program.
Hmm.
But they billed her Medicaid is what they did. So uh
Hmm.
yeah.
interesting.
Mm-hmm.
Might be good to get somebody's info there and
Yeah, I haven't dug that deep. Again,
okay.
I think my mother-in-law is accurate, but I'm not 100%, so might have to dig a little deeper.
The other thing is, I don't know if they're still offering it, but New York State was doing that, like those free classes. What is through the Office of the Aging? It's like not ACT UP. It was ACT or Stand Up or Get Up or Get.
Oh, like
Oh,
the virtual ones?
yeah, I
Yeah.
can't remember the name of it, but it was free. I don't know if that's still a service or if that went away. I was like,
They do a virtual senior center still. We're sharing that membership so people have lifelong members can have access to this virtual senior center, which has like everything under the sun. I mean, there's exercise classes or there's just plain, chat groups and everything. So it's kind of everything in between, but they still do that, but it's not the get set or get ready or whatever
oh,
you're talking about. That's kind of gone away.
okay, I wasn't sure. Okay. Just trying to think of like things that we might be able to put out as resources
Mhm.
for people. But so that's great, like Crunch Fitness. But if anybody knows of any other programs that are happening, and it would be interesting to see if it's like a college or some of the other colleges might have some programs that might be interested in doing something
Yeah,
around this.
for sure. Is Karen,
off the top of my head, I can't think, but is that all in our falls prevention guide booklet? The activities too? I can't recall.
I'm sorry, you kind of fizzled out there for a second.
Our falls prevention booklet,
Mhm.
are those exercise classes listed in there too, the ones we know of?
Yeah, yeah.
Oh,
Yeah,
good.
so they're in that
Yep.
resource. They, again, things change quickly, but the basic ones that we knew of at that time are in there.
Okay, and that's a print.
It's printed and it's also on our website.
Yeah,
What?
it's the
Okay, I'll
pink
go
book.
take a look at- Okay,
If you go on our website, it's the pink book.
perfect. So are there folks that would be interested in doing something around the falls prevention, at least for the week? And are there people who would be interested in maybe trying to keep this going and throwing it out? I'm definitely saying I can put my energy into doing something for the week, but I would need other people to be
Karen,
involved.
I'd be glad to support, the falls prevention. I may have to have somebody, in our agency
Okay.
designated just because I have limited time, but VNS would definitely support it.
Oh, great.
Yeah.
Karen, I would obviously, I think I should say I would help you also, since I've been nudging you about this.
I was gonna say, if you don't speak up. Thank you,
Beth
Beth.
spread herself pretty thin though, I'll tell you. She's everywhere. Can you remind me the week again? I'm so sorry.
That's all right. It's on the agenda too. I think it's this 22nd through the 26th.
Okay.
Yes.
I mean,
And
we'll be there to, we'll try to help in any way too. I
Is
just,
it of August or September?
September, it's right around the corner.
Yeah.
Even if we
I'll
can
be
just
around.
do some stuff as well, like on our social media platforms. and
Yeah.
Some things. I'll send out the toolkit and some ideas and things along
Yeah.
those lines. I did put it all there. People can go and take a look at it and see if there's something that pops up. Do you know what I mean? That seems like, oh, that would be good that we could do with that. I will put together then another quick meeting time type thing for people if they can make it or whatever, of those who said they're interested as well if we need it. But we might just be able to do it through like a Google Doc or email, that kind of a thing as well.
Lisa Monroe just disappeared. So Karen, we have the social dining program on Tuesdays.
Oh, okay.
Maybe that week, if somebody from COPA does any falls prevention education, they could come out and do that with that senior group.
Sure. I'm here. I'm just, no, that sounds good.
Yeah.
Whatever that
Yep.
Tuesday, I'll throw that on the
No,
calendar now.
I'll talk with you and I'll talk with Meals on Wheels about it too.
Perfect.
All right, now I'll see also if I can get other area volunteers, do you know what I mean, that are doing stuff along the lines of falls prevention for around that week. But if there are other, like, I don't know if Thina with Love Living at Home, if there's anything with your group uh, that we might be able to do around falls prevention as well.
Yeah, I think we would love to be a part of that, and we can, either work with, I guess depending if it's Zoom or in person, we'd be happy to be a part of it and promote to our members and the greater community as well.
Great, yeah, if there's any, yeah, that might be good to think about, an opportunity of where we could make it blend in for something around that week, kind of a thing. Super. All right, well, we're at 1:10 or 1:08. I don't know what time it really is. It's sort of after 1 o'clock. Um, is there anything else that as a group we should have on the radar, or that you want to throw in before we leave those conversations? Well, I appreciate everybody's being here and all the hard work. We definitely hear how challenging it is right now with all the funding changes and the uncertainty and everything. And so, if people don't tell you, I just want to say thank you for being a face to people, caregivers, and other colleagues in a really difficult time. It's really important to have each other and to have support. So thank you for all the hard work, and stay tuned because I will be sending stuff out, but please send any of the information that you mentioned as well to me, and I'll make sure that I get that added into our notes and stuff. Okay? All right. Thanks, everybody. It was so nice to see you today.
Thank you, Karen. Great job.
Bye. Take care.
Thank you.
Nicole, can you save the chat by any chance? Is she still here?
Still here.
Okay.
Thank you.
Thank
And
you.
you have to do it because you're the host.
Okay.
Do you
Okay,
know
I
how to
can.
do it?
The last time I couldn't do it
Yeah.
because I wasn't the host, and so I was like, so here I was mad writing people's names and stuff in case I couldn't get it. But last time I thought, oh, I have all of their names in the chat, and then I couldn't save it.
There's also another way to do it too. So if for some reason you can go into the Zoom meeting and you can see who all the people who logged into the meeting is.
Ah,
So
okay. That's
that's
good to know
happened
too.
to me for an HPC meeting, right? So thank goodness I had that. So yeah, let me know if you ever don't have the chat or didn't or lost or something. We could always look at the meeting logistics and see who enjoyed the meeting.
Okay.
Although if someone has like a weird name or something, that will help. But most people use their name, you know, if it says like numbers and letters or something, or their
Right.
phone number or something. But other than that, yeah, we could be able to help.
Okay, perfect.
But great job. That was great.
Oh, are you sure?
Oh yeah. No, it was really great. Wait, hold on. Are we? Did
I
you
don't
stop?
know what this reading AI meeting notes is. I must have clicked something and
Did you stop the recording, Karen? I think you did, right?
I think you know, it had said I was recording, right? And now it doesn't say that
did.
it is. And I didn't stop
Oh,
it.
it's still recording. You have to stop it.
Oh, is it?
I'll have to tell Tamara to take
Oh,
offline.
there it is. Okay, so how do I stop that?
If you
Record
go
to
to
this.
the bottom, it's over where it should say like record or stop recording.
I know normally it's funny because up at the top it says recording, and yet at the bottom I cannot get it to say stop.
To actually head out because when my staff's come over to talk
Okay.
with them. But when we
All
get
right,
off,
as soon as I end it, it'll stop. Talk to you later.
all right, great job. Thanks so much, Karen.
Thanks. Yeah, bye.
All right, bye.